Hi, so today we're going to answer the question, why does the ball of my foot hurt since I've had bunion surgery? And this can be very frustrating. You have surgery to correct a pain in the big toe joint and at the bunion, and all of a sudden now you're having pain elsewhere on your foot, under the ball of the foot, for example. And it's also a very, very common problem. So first, let's look at what happens during bunion surgery. So here's essentially what a bunion looks like. And our goal when we do surgery on it is to bring it over so it's straight and we don't have this bump over here anymore. To do that, we have to make a cut in this big first metatarsal bone here, right? So the cut may be down here, it may be up here, but one way or another, we have to make a cut in that bone to slide the bone over to correct the bunion. Whenever you cut bone, however, that bone will shorten a little bit as it heals. So what happens is this big first metatarsal bone right here, which should be bearing about half the weight of the ball of the foot, it's now a little shorter. And from the side, that means that it's up a little bit. It's not bearing as much weight as it was before. And so this second metatarsal bone has to take up more pressure. So there's a large percentage of patients that do have bunion surgery that end up with a problem underneath here. It could be pain under this area. It could be a callus forming under the area. Occasionally, it's not common, but occasionally you can even get a stress fracture in the second metatarsal bone. So when this occurs, our goal is simply to get the pressure off of this area and transfer that pressure elsewhere, either back here or over this direction, and sometimes back onto that first metatarsal bone over here. And we do that by putting something inside your shoe that conforms fairly close to the arch of the foot. Somebody's going to transfer pressure from the ball of the foot and get that pressure onto the arch. So that can be an over-the-counter arch support. If you go to our website, you can look up a ball of foot pain and you'll come up with a list of some of the better over-the-counter supports that you can use for this problem. If that's not enough, see your podiatrist about getting a custom orthotic. Custom orthotics for this problem, which can be full size like this one for athletic shoes or made small for dress shoes, they're going to work a bit better. Actually, they can work a lot better than the over-the-counter devices because they can conform much closer to the arch of the foot. In addition, we can incorporate into those orthotics special pads like this one that will transfer more pressure off the ball of the foot and onto the metatarsals here. And we can add extra cushion under there to take some more pressure off of it. But it's fairly simple to get the pressure off of that area. So if you're having pain after your bunion surgery, don't live with it. Go back and see your podiatrist, see about an orthotic. If your podiatrist isn't making one for you that's working, then try and find a podiatrist in your area that specializes in orthotics and biomechanics. And again, you can go to our website and just look up ball of foot pain in the search function, and you can find some suggestions on what you can start off with at home.